choose which type of the catheter. Then, if any allergy to latex, some patients they have allergy to latex or plastics. So some of the catheter made from latex. So I have to know if the patient is having allergy to latex, I should not use this type of catheter. Then the indication of catheterization, as I said earlier, if it's just in and out, or if the patient having clot retention. Clot retention, that means he has hematuria, blood in the urine, and there is clots, large clots forming inside his bladder. So if I put small catheter, these clots will close the catheter. So I need to choose big bore catheter, and sometimes we use three-way catheter. I will show you. There are three ways catheter. There are two-way catheter. There is one-way catheter. There's a slide will show that here. So these are type of catheter. So we have on the most left hand the three-way catheter. So we have one for drainage of the bladder, the urine, one to keep the balloon inflated inside the bladder, and one we use it for irrigation. So we'll keep water flowing inside and come from the other way in case of hematuria or bloody urine. This is called three-way catheter, and usually it gets large bore, large opening, so the clot will come out through this. We have something called caudate tip. So the tip of the catheter is curved, and this is used in patients with benign prostatic hyperplasia, large prostate, so it will take the shape of the urethra. And on the most right hand is the two-way catheter. This is the most commonly used catheter in the hospital setting, either for the drainage or for temporary in and out. So all of these type of catheter, the most common one used is the two-way catheter. Two-way, one to drain the bladder, and the other way, which is the small thing here, is just to inflate the balloon to keep it inside the bladder, so it will not slip or come out. So what about the size? So we talked about the type. Now size for pediatric, we use 6 to 10 French. 6 to 10 French. So the one French equal to 0.33 millimeter, and usually describe the outer diameter of the catheter. So there is no millimeter here. All catheter usually written by a French size. 6 to 8 usually the pediatric size. Adult female 12 to 14. Adult male 16 to 18. Most commonly we use 16 French. But in case of blood, and we need to drain and wash, we usually use bigger size catheter, as I told you earlier, like 22 French, and the three-way catheter. For the length, usually it is a fixed number. For pediatrics, it's about 30 centimeter. For female, short one, 26, and for male, 43 centimeter. Can I use female catheter for a male? Yes. And can I use a male catheter for female, especially the two-way catheter? If it's the fixed size, which is 43 centimeter, I can use for both male and female. Yes, the measuring unit is French, and each French equal to 0.33 millimeter. Okay, so now I already having a patient with a clot retention. I decide what catheter size I will use, what catheter type I will use. So I'm ready. Just before proceeding, you have to explain the procedure. Anything you're going to do to a patient, you have to inform him. What are you going to do? What is the indication? And what are the expected complications? And some of the hospital policy, they need consent to put a catheter. So again, you will ask the patient to sign the consent. Okay, so explain the procedure to the patient and its necessity, why we are doing that. For acute retention or for chronic retention, we usually keep a catheter for, depending on the codes, uh, sometimes 3 days, sometimes 1 week. It depends on what is the reason. Usually, in case of benign prostatic hyperplasia in old gentlemen who have prostate, if they are not in medication, we usually put the catheter and start the medication, and then after a few days, we remove the catheter and let them try to void. How about the positioning? For both male and female, usually they are supine. Supine. So lying flat for a male, but in female, we'll do something called frog-like position. Frog-like position. We'll come to that in a minute. You need to have a witness with you, especially if a male and a female patient. You need to have somebody with you, like a nurse, to help you and to stay with you. So always a witness. It's a private area and very sensitive area. Always keep a privacy for the patient and keep somebody with you. You need to undrape the patient from the level of the umbilicus to mid-thigh or to the knee, so the area of interest is fully exposed. Then start the sterilization. Usually the genitalia, the penis and the vagina in female is the most, let's say, dirty area in that area. So we need to start when we clean for the most clean part. So from out, in, from out, in, from away from the genitalia and the direction toward the genitalia, because this is the most dirty part. What type of solution you can use to clean? Whatever you have, especially if the patient has no allergy from betadine, or you can use chlorhexidine. All these disinfected material are acceptable. Then you have to have a tray. We'll look into a video explaining all this in a minute, but these are just the steps. So prepare a sterile suitable catheter as regard material, either silicone, latex, or even plastic. As regard to self-retaining, هل هي فوليس؟ فوليس معناها فيها balloon. There is a balloon to keep it inside the bladder. It will not come out. Whereas Nelaton has no balloon. It's only one way. Some patients who have neurological disease like spinal cord injury, they are doing something called self-catheterization. They catheterize themselves every 6 hours to empty their blood. So we use this catheter, which is called Nelaton catheter. And again, as regard the size, you choose the appropriate size according to the patient age, the urethral meatus, and the patient gender, male or female. Then put the sterile gloves, get a catheter out of its bag, lubricate the catheter thoroughly with water-soluble lubricant like KY gel. And then hold and straighten the penis, make it straight with your left hand if you are right-handed, and the opposite if you are left-handed. Then inspect the urethral meatus for any discharge or inflammation. And if you notice that the catheter bigger than the urethral meatus, you can still get another catheter smaller size. Then start inserting the tip of the catheter in the urethral meatus gently and pass it gently, smoothly. If there is any resistance, if there is any difficulty, always stop and then ask help from your colleague. If there is no resistance and the catheter is introducing smoothly, then don't stop until you introduce the whole catheter in and the urine start to flow. And whenever the whole catheter is introduced and the urine is coming out, then it's uh, inject 3 to 5 cc of water or saline in the valve of the balloon. So if you are going to keep the catheter, there is no fixed number for this 3 to 5. Usually, every catheter it has a number written. So check also that number. It will tell you how much, how many cc is the balloon of this catheter need. So some catheter they will need 5 cc, some of them 10. In case of three-way catheter, usually we inject 30 cc. So always check that. Then, after you inflate the balloon, connect the catheter into a drainage bag and fix the catheter into the thigh of the patient so it will not be pulled out. Yes, Abdullah. Well, disinfection usually in catheterization, we start away from the genitalia and we come there. You can do it in like in a circular manner. So you start the bigger circle out and then you make smaller circle toward the genitalia. So outside to inside. Okay, let's see this video. It's about 5 minutes. ما في صوت يا شباب.
The sound is low, doctor. Very low.
Low. Let me try something here. That's the maximum. No worry, just observe how they are doing. They are just repeating what I explained uh, in the lecture. Uh, so at the end of the video, we can I can answer your question and I can give you the link for this video. No worries. So let's just see how they are doing it. طيب for sterilization there are two techniques. The one I explained to you is the standard, and some of them they are using the one you will see, which is preparing everything on the table sterile, and then when you put the sterile gloves and hold the genitalia with non-dominant hand, like the left hand, you don't touch anything with your left hand. Your left hand is considered a non-sterile, and you do the rest of the procedure with your right hand. This is another technique of doing this. You'll observe, so different technique, the one I explained to you, or this one, both are accepted. You can later on, if you are trained on these things, you can do whatever technique you like. So let's continue. Okay, no, patient is not under anesthesia. You don't need to anesthetize the patient to insert the Foley's catheter, but you use local anesthesia. Syringe she was using, الإبرة اللي حطتها the local anesthesia. That's why you inject it and then you wait for like 2 minutes, 3 minutes. It will decrease the sensation and the pain associated with the insertion of Foley catheter. So the principle is the same. Uh, if you are using the way I explained to you in the slide, or this way, the principle is the same. Keeping one hand sterile and the other hand non-sterile, but you don't touch any of your instruments if it's non-sterile. The left hand, for example. If you would like to use both hands, no problem. You can start sterilizing without touching the genitalia. And when you sterilize everything, you can use both hands freely. I mean, you can use both hands and they are still sterilized because you sterilize everything around. So that's for a male patient catheterization. The catheter she used is two-way catheter, Foley catheter. ليش Foley? Because it has a balloon اللي كنا عبتها في الصلاين أو في الwater, so it will stay in the bladder. Okay, let's proceed with female male catheterization. So again, the same principle. You need to explain the procedure to the patient. Position here is different little bit in male from female. Both will be supine, that means they are lying flat on their back. But for female, you let them do frog-like position. So they flex their hip and uh, put their knee away. So flexion at the hip and knee joint. In position they call frog-like position. So the perineum will up. Then again, you will disinfect the same way, either to use the one-hand technique, which we saw on the video, or use two-hand technique, so you extract the whole thing. The perineum, the vulva, urethral opening, with either betadine or fluoxetine. Then you prepare a sterile suitable catheter, done with the size, material, and the type. Again, glove your hand with the sterile gloves. You will get the catheter out of its bag, lubricate it. Always lubrication. Lubrication will help make it pain, her pain, or the pain less, and it will go easily. Then in female, you need to separate the two labia with sterile gauze and then affect the urethral meatus for early discharge information, similar to what we did in male, and then introduce the tip of the catheter into the urethral meatus until the urine is coming out. Then again, introduce it more. Don't inflate the balloon yet. Just introduce it more, and then inflate the balloon with water or saline. Again, check what is written in the catheter. Some catheter 5 cc, some catheter 10, some then 30 cc. And then connect it to your urinary bag and fix the catheter. It's not a lithotomy. It's not a lithotomy. It's called frog-like position. Frog-like position. Supine, but the hip and knee flexed. The gel used, yes, there is a local anesthesia in the gel. So the KY gel is a plain gel. There is no anesthesia in it. But some of the gel they call lidocaine gel. It has 1 or 2% local anesthesia. Yes, even ream stessel, even if the patient is a child, yes, because the procedure is just 1 minute or 2 minutes. So you don't need to put the patient under general anesthesia for 1 or 2 minute job. The 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 harm of anesthesia is more than the harm of 1 minute job to do. So we still give them local anesthesia, like the gel has anesthesia in it, local anesthetic agent. It will reduce the pain. Let's see the video for the female and come back for the question. which is non-needle needle syringe, and then aspirate the fluid you put, 5 cc or 10 cc, till you completely aspirate everything, nothing coming out. Then you start pulling out the catheter gently. If there is resistance, again, try to empty the balloon again and take it out. Okay, now we'll come to the questions. تركي يسأل يقول كأنها تدخلها بسرعة ليش؟ Well, in female, both you have to be gentle, but in female it is easier because the urethra is short. Female urethra is short, not like a male urethra. It's shaped in the male, and there are sphincter, there is prostate, so you need to be extra careful in male. Whereas in female, it's usually easy insertion. What other questions do you have? How to remove a catheter? Well, again, a catheter, just deflate the fluid you injected into the valve. احنا حطينا 3 to 5 cc or 10 cc into the valve with the syringe. Then you cannot remove the catheter unless you remove this fluid. Rod saying, I saw some nurse put the gel just to the catheter and then insert it. It's okay, but it will be painful because you did not put anesthesia. It will be painful for the patient. But again, it's okay. Yani if the patient is under anesthesia, for example, in OR, the patient is going for laparoscopic cholecystectomy and you need to put a catheter, you will not feel, or she will not feel. So there is no harm on putting a gel just on the tip of the catheter and then insert it. It's okay. They say teach the patient how to use it. هذا عادي you said. Yes. So I told you earlier during the slides, some of the patients they have like neurological disease and they cannot feel their bladder. So we can teach them how to do that intermittent catheterization, or how to close this catheter and open it. So every 4 or 6 hours, they go back on and then they open it, so it will drain what is inside the bladder. Abdullah Yasel, I meant after emptying the catheter, do we just, yes, you just pull it slowly, so it will be easy also going out or coming out. But sometimes this balloon will not empty. So if there is resistance when you pull the catheter out, stop, don't pull. Always in this procedure, either insertion or removal. If you have any problem, difficulty, just to stop, call a urologist or some senior person to come with you. If you want to manipulate, again, make sure that's the empty. So again, put your syringe, try to aspirate. Maybe there's some residual fluid inside this balloon. It's not completely empty. So try to take it out. There's daily use catheter, right? I mean smaller. Yes, that's what we call self-catheterization or intermittent. Intermittent, that means every 4 hours, 6 hours, depends on the patient. They will put a catheter without balloon, without anything, just one-way catheter. It's called Nelaton catheter, and they are smaller. Yes, for female it will be short, for male it will be long. And then the patient will put it inside his bladder. Whenever he is emptying his bladder, they will throw it away. They will take it out and throw it away. And after 4 or 6 hours, they will repeat again. How often do we need to change the catheter? Well, it depends. If it's a rubber catheter, that it depends on the type of the catheter. If it's rubber, then 2 weeks. But if it's silicone or silastic catheter, latex catheter, they usually last longer, like every 3 months. But if the catheter gets blocked تقفلت لأي سبب من الأسباب, or the patient got infection, UTI, then I need to change it with a new one. Otherwise, you don't need to change it unless 3 months for the silicone catheter. And I can ask him, is there a difference between it and suprapubic catheter? Yes. So for the catheter itself, the type catheter, it's not different. It's the same catheter, but the insertion of the suprapubic catheter is totally different from that. I don't think it's the time to explain it because it's I think at advanced level. Only urologists can do that. But it's directly from abdominal wall into the bladder. I think the only confusing part in this lecture is the sterilization technique. I explain something, and then I show something else, but it's good for you because you have now different techniques. So both are correct. The one hand technique is correct, but you have to not use the dirty hand. Halas, it's only dirty, so you don't touch any of the instruments. The other way, which is explained in the lecture, is to disinfect everything. So before touching anything with your hands, you just clean with bovidin iodine or chloroxidine. And at this time, everything is sterile, so you can use both hands. Yes, the catheter is painful. Most of the patients will complain of catheter pain at the tip of the meatus. It's not a pleasant sensation, but it's a must. If the patient is retention, we have no other option. We have to drain the catheter, drain his bladder. Some of the patients, when they move, they will feel pain from the catheter because the catheter is moving, so it will irritate the bladder. So we can just fix it, ask the patient to fix it on his thigh with Mefex or Hagafex or a blaster. This will reduce the pain. And I touch the patient with my non-dominant hand, only right. Yes, if you are right-handed, so the right hand is used to touch the sterile field, but left hand, you should not touch any of your instrument, just the patient's body. Abdulmajid, when we sterilize from outward, we will drag the microbes. No, the most dirty part or full of microbes area. So if you do the opposite, you bring more because you're taking the bacteria and germs and flora, whatever, from the meatus or vulva or genitalia and separated around. Yes, always control the catheter and the sterile instruments with your sterile hand or dominant hand. Which we have the model and this part you need to try. You need to practice. It's not practical. It's clinical. It's easy. Inshallah, whenever we have time and we go back into the lab, we have a model and we can try. العفو دكتور علاء. So here's my email. If you have any questions, you can still ask me. Any questions before we end up this session? Okay, good luck. Thank you for your attention and good luck.